Dave Tosch, Executive Director, Wenatchee Valley Senior Activity Center, and today I'm with Jessica Arroyo, who is with Health Alliance here in Wenatchee. I got to tell you that I've been here almost 8 years, and Health Alliance is in the same boat. I remember I got here in July of 2013, and within a month or so, a lady by the name of Shannon Sims came in and said, "Hi, I'm with Health Alliance," and I had no idea who Health Alliance was. They were new to town and just getting going. And I must say, though, that we have had an excellent working relationship with Health Alliance during this time period. And they've been one of our biggest supporters, helping us in a number of different ways. And we really appreciate that support. And so, Jessica, tell us, our audience, a little bit more about Health Alliance as an organization.
Absolutely. So I'll introduce myself. Jessica Arroyo with Health Alliance Northwest. I am the Community and Broker Liaison. I have been with Health Alliance since 2014. So I came in about a year later, and I think we met in 2016.
Yeah.
As Shannon transitioned out, I came in, and it's been really great to know you and work with the Senior Center in the past years. As you mentioned, Health Alliance partnered up with Confluence Health back in 2013. And we really wanted to bring that Medicare Advantage option to all of our communities, which include Chelan, Douglas, Grant, and Okanogan County. Health Alliance is a Medicare Advantage plan for anyone that is Medicare eligible. So we just really wanted to be a resource.
Okay. And I know that there's a lot of local brokers and agents here in the community. You want to talk a little bit about how someone would access Health Alliance in that way?
Absolutely. So we do work with very many brokers in our areas in all of the 4 counties. So how it would work is we would go over the health care options that we offer, and if they really want to explore something else, or just to see what they can find, we would absolutely refer out to our contracted brokers. Mm-hmm.
And so I remember doing a golf tournament. I think it was that first fall maybe that you were here in town, and I got to meet several different people that were connected with Health Alliance. Mm-hmm. And I've always kind of wondered, you mentioned that you do work with Confluence Health. And can you tell us a little bit more about how that relationship works and how that came about?
It really came about because what was happening, there were very many Medicare Advantage plans that would come in and go out of the service area very often. And so what was happening is there wasn't very many plans, especially up in Okanogan County, where Confluence is located, and there wasn't a healthcare option. So Health Alliance, Confluence Health, learned about Health Alliance from Illinois. And so they had a model that Confluence was very interested with the provider and insurance being in partnership together. And so they were really interested, and that's kind of how it came about, that we were invited in and to serve North Central Washington.
Mm-hmm. So it sounds like it was Confluence that took the initiative to go out and find what they thought was the best organization to fit the needs of our community, which is pretty neat. I mean, the way that came about. But you mentioned you do cover 4 counties.
Yes.
And when you're covering those 4 counties, is that also fitting within Confluence Health coverage of those areas? Or
yes, so the 4 counties is where Confluence is located. So if you see someone up in Oroville or someone in Royal City, Health Alliance would follow you. But of course, we are so grateful for all of our other local providers in each town. So that was the main focus. Yes, Confluence Health, we are in partnership with them and super grateful, but we also have those doctors that you know and trust, Columbia Valley Community Health or Cascade Medical, Samaritan and Moses Lake. I mean, that was really the focus of bringing this plan here.
Okay, all right. Well, that helps. We're pretty good friends with Jim Heinlein and now Springwater Insurance, used to be Senior Insurance, and they were located right here at the Senior Center for a number of years. But, you know, Jim has obviously got a very large number of customers, and we also have other smaller brokers out there that can also access your plans. You want to talk a little bit more about that?
Yeah, absolutely. So it's really nice that we have our local office here, so we get to personally meet our brokers. So we, service our brokers just as well as how we service our members. So if there's ever any question or concerns that come up, we have that relationship.
Okay. Can you talk about any unique advantages that are offered by Health Alliance that a customer may not find elsewhere?
Yeah, absolutely. So we're really strong focused on the care coordination and case management. And what that means is you'll have a nurse that can help you navigate through very, could be difficult situations, especially if you have a chronic illness that comes up or something you just weren't expecting, and they can definitely have that same language as your provider and kind of explain that to you. We're really lucky at Confluence Health that we have our team of case managers, and they really help our members understand their benefits and what they can get out of it. So if you were just released out of an inpatient, what are your benefits and what can you receive with that? And like I said, manage their prescriptions. Does this work well together? So it is really that person backing you up with all of your needs.
And so you have, I call it new, but you've been in your new location for about a year. I believe that's on 5th Street, and is it Chelan?
Yes.
And so one of your customers can go down and meet someone face-to-face right there in that location.
Yes, absolutely. So we are now at 411 North Chelan Avenue, Suite A, here in Wenatchee. So just kitty corner from where we originally were. We are open by appointment, and that is Monday through Friday, 8 to 5. Give us a call. If you are a member, just look at your Health Alliance membership card, the customer service on the back, the phone number, and set up that appointment. But we are open, and we're excited that we can still see each other face to face and continue to build our relationship.
By appointment.
Yep.
Yeah. So Jessica, over the past almost 8 years, Health Alliance has come out and you have supported some of our fundraising events, and whether it be, I think, the crab feed, we've had some musical groups come out and entertain us. We've really appreciated that support. And what I really liked is you bring some of your folks out here and participate with us. But so I'm aware of some of that. But what else in your role do you take care of for our communities?
Absolutely. So the main goal is gathering resources from every community that we're in. So when we do have a member in need, we are aware of what's going on in each town that we are in and offer that. It might be, just got a cancer diagnosis. Where can I go? Refer to the wellness place or transportation or, whatever it might be. Another thing that we really focus on, and is what I love, is education. So kind of going over your healthcare needs, financial planning, it's just that education component that really drives, and just making sure that everyone is aware of everything that is going on with, especially Medicare related. That is something that can really cause a headache if, especially with all the information out there. So
yeah, I know there's a lot of confusion at times on all these plans and programs and who's doing what and where everybody fits. And I think having Health Alliance here in the community, though, has really cleared a lot of that up. Of course, things are going to keep changing over time because that's the way it works in our world. But I just want to say thank you very much for joining me today, Jessica, and we will look forward to working with you in the future. I think Health Alliance is going to be in our community for some time to come.
Absolutely. Thank you. And let's hope that we can have expos soon and events that we can all see each other, and another dance, because I miss our dances.
Thank you again.
Thank you.